What if a free 30-minute test could prevent your future heart attack? Millions of eligible Brits are missing out on this life-saving opportunity, and you might be one of them. It's the official NHS Health Check, and if you're aged 40 to 74, you are entitled to it. This isn't a vague chat with your GP, it's a targeted check for the early warning signs of stroke, heart disease, and diabetes, before they become a crisis. Today, Your Health UK is demystifying this vital service. We'll show you exactly what happens in the appointment, how to book yours, and crucially, how to understand your personal risk score. This isn't just another guide, it's the knowledge you need to potentially add years to your life. Stay with us. Here's what most people get wrong about the NHS Health Check. It's not for when you're already sick. The truth is, it's a powerful tool to stop you from getting sick in the first place. Back in 2009, the NHS made a massive change. They realized it's far better to prevent serious conditions like heart disease, stroke, type 2 diabetes, and kidney disease than to try and fix them later. Your GP may not put it this way, but it's basically a free, midlife MOT for your body. The moment we hit 40, our risks for these diseases naturally start to climb. What's shocking is that the biggest red flags, like high blood pressure or high cholesterol, are often completely silent. You wouldn't even know they were there. Think of this check as a personalized snapshot of your health. It spots those hidden dangers, giving you the knowledge you need to make changes and get early support, long before symptoms ever appear. So, is this free health MOT for you? If you're in England and aged between 40 and 74, listen up. You should get an invite every 5 years. But here's the crucial detail most people miss. You're only eligible if you haven't already been diagnosed with certain conditions. We're talking about heart disease, chronic kidney disease, diabetes, or a previous stroke. The logic is simple. If you have one of those, you should already be getting more specialized care from your GP. This check is something different. The same goes if you're on medication like statins for high cholesterol, you won't get an invite. Here's the truth, this program is designed to find the silent risks. It's for the millions of us who think we're perfectly fine, but might have something dangerous lurking underneath. What's shocking is, you might be eligible and never get that letter. Your GP may not tell you this, but you can't just wait. Be proactive. Pick up the phone to your GP surgery and ask. Some local councils even list places where you can get a check done. Don't wait to be invited, so you finally booked your check. But what actually happens behind that closed door? Here's what most Brits get wrong. They think it's some scary, intimidating medical exam. The truth is, it's not. It's a straightforward chat that takes just 20 to 30 minutes with a friendly nurse or healthcare assistant. It all starts with a few simple questions about your lifestyle. Things like your diet, how much you move, your alcohol intake, and if you smoke. Then, they'll ask about your family's medical history. What's shocking is how this one detail can be Now for the really crucial bit, the blood test. For most people, this is just a quick, simple finger prick. But here's what most Brits don't know, that tiny drop of blood tells a massive story. Its main job is to check your cholesterol, your total levels and that all-important good cholesterol, or HDL. And your GP may not tell you this, but if they spot other risks, they'll also check your blood sugar. They use a clever measure called HbA1c, Here's what most Brits don't know about the health check. This is where the real decoding begins. All that information they gather, your age, sex, ethnicity, BMI, blood pressure, cholesterol, it gets fed into a powerful NHS calculator called CRISC-3. The truth is, this isn't just some simple spreadsheet. It's a clever algorithm, built by doctors and academics, that analyses how all your risk factors interact. And here's the shocking part your GP might not have time to mention. It even looks at your postcode. Yes, your actual postcode. Plus any other conditions you have, like rheumatoid arthritis. It all boils down to one single, incredibly important number, your percentage risk of having a heart attack or stroke within the next 10 years. So, what does a 15% score actually mean? It means out of 100 people with a profile just like yours, 15 are predicted to have a serious cardiovascular event in the next decade. But listen, this isn't a diagnosis. It's a forecast. A statistical warning shot that gives you and your doctor the power to change your future health. It is the absolute centerpiece of the entire health check. So, you've got your CRISC-3 score. This is the moment of truth. But what does that number actually mean for you? Let's break it down. A score below 10% means your risk is low. You're in a good spot. But between 10% and 20%? That's a moderate risk. And what's shocking is that anything over 20% is considered high risk. Here's what most Brits don't know. That 10% figure is the mag. The truth is, the health check is just the starting line. The real value is what you do asterisk after star. Here's what most Brits don't know, you won't just be told to be healthier and left on your own. The advice is personal and it's practical. You'll be pointed to real, local services. Think NHS stop smoking programs or weight management groups right in your area. Now, here's something your busy GP might not have time to list out for you. There's a gold mine of... So, what's the bottom line? The NHS Health Check is your free midlife MOT, a straightforward, 30-minute check-in for those of us in England aged 40 to 74. It's a fantastic chance to get a clear picture of your risk for serious conditions like heart disease, stroke, and diabetes, all from some simple tests. The real power comes from what happens next. You'll get a personal risk score that lets you and your GP create a plan together, putting you firmly in the driver's seat of your own health. If you know you're eligible but haven't had that letter yet,